Let's talk about an herbal protocol for Lyme disease. Lyme disease has a number of different methods of treatment, and we're talking mainly here about chronic Lyme disease. Acute Lyme disease, there are some very straightforward, proven antibiotic treatments that I like to use, and very rarely will I use an herbal protocol for that. In a patient that has chronic Lyme disease, it's a much different beast, and there's a lot of other things that we are looking into with that. So herbal protocols can be a good option for a lot of patients. So let me talk a little bit about what type of patient I would use an herbal protocol with. So I would say that there are probably three main reasons why I would think about using herbs versus something like an antibiotic or other medications. First is simply just patient preference. There are a number of patients who much prefer a more holistic, natural approach to treatment, and an herbal protocol definitely fits that picture. So I like to really take into account what a patient wants and what they are looking for in their treatment. I definitely will give you my recommendations, and if there are other treatments beyond what you're looking for, I want to make sure that you know about that. But if someone wants a herbal protocol, we'll go with it. We'll do the best we possibly can with that. Secondly, if you've got a patient that is extremely sensitive, for instance, they don't handle other medications very well. They tend to react in a negative way. So herbs can be a lot more gentler on the body and have other beneficial effects beyond just killing bacteria, that they can be a good option in those cases as well. And actually, I'm going to add a fourth one. So the third option would be, let's say we have someone with chronic Lyme disease, but their symptoms are such that it's not necessarily debilitating, but that they still want to see improvement. So a lot of times when we use medications and other more potent treatments, or ones with potential side effects, we sometimes will actually see some of those side effects or other effects from the medication make it kind of tough to get through some of that treatment. And so if someone's not coming in feeling miserable, but just wanting some improvement, it might be more beneficial, or might make more sense to start with something like an herbal protocol. And then the fourth one would be, if I've got a patient who I have on a medication protocol that either needs additional support, but we don't want to continue to layer on medications, or we're ready to come off of those medications and start tapering off of treatment. I really like, and I will do this with almost every patient, I will take them off of their medications and switch them to an herbal protocol, making sure that all of our symptoms remain stable, and that when we're doing this, that the symptoms aren't getting worse and coming back. So those are kind of the four main scenarios. But let's talk then about which herbs do I use. So in a case of Lyme disease, a lot of times, as I've talked about before, we're dealing with Lyme, we're dealing with co-infections, we're dealing with inflammation, we're dealing with opportunistic infections, autoimmune reactions. So there's a lot of factors that we have to be watching for and addressing. So specifically though, I like to start with a few different types of herbs that will cover the vast majority of Lyme and the co-infections that may exist, opportunistic infections included. And I would say the three that I use the most are Japanese knotweed, cat's claw, and cryptolepis. Those three, if you look at the studies that have been done about herbal protocols for Lyme, and I will say that one of the downsides of herbal protocols is that for the most part, the studies are all done in vitro. I have not seen a ton of in vivo studies for them. So a lot of this is looking at what does the herb do to the bacteria in a test tube. Sometimes, we know that doesn't always translate perfectly to what happens in the human body, but we have to start somewhere, and that's where most clinical trials will start. So in these particular studies though, those three, the Japanese knotweed, the cat's claw, and the cryptolepis, tend to be ones that continue repeatedly to have a benefit and have an effect on these bacteria. And reproducibility in a study is super important. So that's, for me, one of the reasons why I use those three most often. And just clinically speaking too, I've had a lot of patients that respond to these particular herbs. Other herbs that I'll sometimes use as well, artemisinin is one that I'll use fairly often. Sometimes I will also use some of the other protocols that are more of like a multiple herb in a tincture or in a capsule. You've probably heard of, or may not, but the Cowden's protocol is an herbal protocol that's got a very specific regimen. And a lot of those herbs are either in a tincture form. There is the Byron White formulas, which have the multiple herbs per tincture. And when I say tincture, what I'm talking about is a little bottle that's got that liquid in it. It comes with a little dropper, and you count your dosage by the drops, not by the number of tabs or capsules. So those are some of them. Beyond Balance is another company, and comparing those types of things here. So like, when do I use those versus when will I use specific herbs? So most often I like to use the specific herbs first, especially if a patient can tolerate swallowing a capsule. I'll get the resveratrol and I'll get the cat's claw in a capsule form. Cryptolepsis more often than not comes in a tincture. So we'll start with those and we'll see kind of how things go. And I like to layer it in there just like I do with other treatments. I'll start with one, give it a week, add the second one, give it another week, add the third one, and continue to increase in those dosages until we get to a point where we're seeing good improvements. Or sometimes we get to a point where we're feeling like symptoms are actually getting worse and we're not able to get those symptoms to calm down with additional time. So sometimes we have to go and find what is the highest tolerated dose, and then we'll stay there. So that's kind of the approach I like to take. I feel like it's helpful for me, and I think it's helpful for the patient to know too, is there a specific reaction to a specific herb? Is there one that seems to be working better or one that's causing specific problems? And we tend to find that more when we use more specific treatments. And so that's generally how I like to start. When I'll use other protocols, like for instance, Beyond Balance and Byron White, both of which are like a multiple herb tincture, is specifically for kids that can't take a capsule, can't swallow a capsule. Those are really good. In fact, I really like the Beyond Balance formulations for kids because they seem to be a little gentler. Byron White, I honestly don't know exactly what it is about them, but they seem to be a little more potent of an herb. And so you would think that let's use the strongest stuff you got, right? But for some people, and I've had this happen where even one drop of them in a glass of water will cause people to not feel well on those particular herbs. And I don't know if that's just a side effect of what they're taking or if that's a Herxheimer reaction that's happening because of the die-off of the bacteria, but it tends to be a limiting factor for a number of patients. Now, that's not everybody, but a number of patients that is the case. So between the two, Beyond Balance, in my opinion, is probably the more gentler formulation that you can kind of get a more gradual increase in the dose and tends to, I think, work better for kids. The other thing that I think about too is, just like with any medications, we want to make sure that we're treating some of the persistent stuff that is either encompassed in biofilms or has other protective mechanisms that are keeping it from being killed. So it's really important as well that when we are treating patients with an herbal protocol, that once we get established, that we add things like biofilm treatments. And I tend to use more of the herbal supplements, enzyme approach for that as well, just because, again, it's effective, and I find that it's tolerated quite well and fits in really nicely with an herbal protocol. Actually, I'll use a lot of these biofilm treatments with other treatments as well, but not just herbal, but I like these ones. And the three that I use would be lumbrokinase, monolaurin, and serrapeptase. There are a number of others, and as far as the efficacy of those ones, I'm sure there are good ones out there. These are the three that I've used most frequently for me, and these are the ones that I see clinically. I've seen results with, and so it's just what I'm comfortable with, just what I use. But those are definitely three really good options: the monolaurin, lumbrokinase, and serrapeptase. On an herbal protocol, a couple of things that I notice from a clinician standpoint, it does seem to be less potent in most cases compared to some of the medication treatments that we can do. And the trade-off, and I guess the benefit, is that you're going to potentially have less side effects, and so that's a positive thing. But if we've got a more advanced case, if we've got significant neurologic Lyme, I personally am not a big fan of starting with herbal protocols if we can help it. But if we're going to go that route, I think that definitely something you want to give some time to. So, instead of like a 4 to 6 week follow-up, I might put it out a couple of months to give them time to let the herbal protocol work for them, to see if we're going to notice any changes. And so I think that's number one. It does, in my opinion, seem to be less potent and take more time to be effective. And then length of treatment is really going to depend on the patient. And we've talked about this before, but chronic Lyme patients, they've been dealing with these symptoms and this illness for years in some cases. And so it's going to take time. It's something that I expect, especially if we're going more of an herbal protocol route, that it might take several months before we really feel like things are starting to turn a corner. It might take a year and a half before someone is really feeling like things are going well. And there are some patients who continue to take the herbal treatments just as a way to kind of sustain things because it works for them. And relatively speaking, the trade-off is if they take the herbs, and even if they're not 100%, but they're doing a lot better, it might be worth it just to continue on them. So that's one of the benefits, I'd say too. Again, we're not worried about kidney function or liver function very much with any of these things, and so you could take it indefinitely if you really needed to or really wanted to. So that's generally what I will do with an herbal protocol. I do like to get to the point where I can taper off of that. That would always still be my goal. So with a patient that's at that point where they're ready to get rid of the treatment and be done with it, then I will taper them down and I'll start coming off of the medication or the herbs here and see how they do. Again, kind of watch it as we go, and as long as they're doing well, I think that we can get to that point. But the case of each case is going to be different, and I do think that it's okay if someone decides that they're going to stay on them just for whatever reason, if it just is helping them to feel better. I hope this was helpful for you. If you have any other questions about this, please feel free to leave them in the comments below. I'd be happy to answer any specific questions, specific herbs maybe obviously we didn't talk about. I'd be happy to comment on some of those as well. Or if you have some herbs that you've found that have been helpful for you, or someone that I'd love to hear about them as well. So thanks for watching with me today, and we'll see you next time.